Ladies and gentlemen, please join me on this journey to a health destiny with 5 points that are easy to understand. First of all, this fellow Salvatore Frascinella was a 65-year-old New York executive who was facing bad times because he had 3 cardiologists who felt that he was too risky for the bypass surgery. And he was getting worse on a dozen pills a day, couldn't walk 2 blocks without severe incapacitating pressure in his chest, and he was desperate. He came to a health program that I gave, though, and things changed for him. He was hopeful. I said, I believe you can get off most of your medicine if you will follow what I suggest. And he talked to one of his cardiologists about it, who said, you'll die if you do. And I think he outlived his cardiologist. He lived another 30 years, from 65 to 95. And that's an example of how I believe the body is designed for self-healing. Just like cuts, burns, bruises, broken bones heal, so will the body mend the disease process if we harmonize with natural laws. But the number 2 view of this is that medical care is not health care. It's really disease care, made so by prescription drugs and the process. When I have one teacher who said he was graduated from Harvard Medical School, and they told him that half of what we're teaching you is not so. We just don't know which half. Well, I'd like to suggest that the half that is not so good is, number 1, diagnosis, because they can measure and scan and do blood tests and x-rays and all that and tell you a name, but they don't know the cause. The medical textbooks, when I took internal medicine, said unknown etiology for most of those diseases. Whether it's arthritis or colitis or something else, they just don't know the cause. They can identify risk factors. Sadly, they don't call them the cause. You know, if a person smokes and you're at risk for lung cancer, they don't say it caused it. Well, I think so. And the bottom line is that we need to identify true cause and deal with it, but the drugs, that's the part 2 of medical care, do not address the cause. You can eat a high cholesterol diet and plug up, but their treatment may lower the cholesterol in the blood, but it doesn't really get, you know, if we're eating the diet, why not just stop the diet? You know, eat less cholesterol, and we would be better off than a drug that might give us adverse drug reactions. Because I have the medical literature on this. This one here, bottom one, shows that the JAMA, Journal of American Medical Association, in 1998, tax day, April 15, said that there was 106,000 deaths from adverse drug reactions, and the definition of that is properly prescribed. It wasn't a bad prescription, and the person took it according to the prescription, but somehow people just react badly sometimes. And the next article just above this is the Western Journal of Medicine, and it says, the first study from JAMA, Journal of American Medical Association, was in hospitals. The second, you might wonder how many die outside the hospital. That's June of 2000, the Western Journal of Medicine, and 199,000 died. So put them together. Inside the hospital, outside the hospital, makes 305, and medical care at that point, 20 years ago, was the 3rd leading cause of death. But then, another study published almost 10 years later, in September 10 of 2007, reporting on a period of time that you can see right here, from 1998, that was the JAMA article, for 7 years until 2005, said that the adverse drug events, the deaths, increased 2.7-fold. So multiply 305,000 times 2.7, and medical care is number 1 as the cause of death in this country. They're not saying that, and there's no more studies. They're afraid to look at it, I think. They don't want that out in the news. But the bottom line is that drugs can kill you, and along with the greed of doctors to do surgery and medical error, because the adverse drug reactions are non-error. They got the right medicine. So all of this said, bad situation, why would we want to go there? I want to share with you what true health care is. This is point number 3. And Breslow, Dr. Breslow, Dean of UCLA School of Public Health, did a 10-year study, federally funded, found 7 simple health habits good for a 30-year advantage. Okay, That's more than medical care could ever give you. And basically, if we do these habits, they have the 30-year advantage as compared to people who break all the rules, like smoking, drinking, obesity, and so on. But this study did not look at specific foods. This was before the Framingham study reported on cholesterol. If you include cholesterol, you can reverse heart disease. This is U.S. News and World Report around 1990. Okay, so it's possible, it's being done, and cardiologists like Dean Ornish, that article was featuring him, California cardiologist, or Dr. Esselstyn, Bill Clinton's cardiologist from the Cleveland Clinic, wrote the book on prevent and reverse heart disease. And we can do that, but not everybody is, you just don't hear about it, but go to the YouTube and look up these doctors' names and watch their video. It's excellent. So, we've covered 4 steps. Medical care is not health care. Adverse drug reactions make it a leading cause of death. True health care involves health habits. And if we address the diet specifically and include the right parts of it, we can enjoy great health. Sometimes it's hard to sort this out. When I was in executive health at Loma Linda University, I had one executive say that sugar bothered his joints. I had another executive tell me that cheese bothered his joints, and a third one said meat bothered his joints. These were smart men. They'd figured it out. But when I got headaches, I couldn't figure it out. I didn't see a relationship. Anything I ate, it didn't give me a headache as far as I was concerned. But I even went to the neurologist who taught medical students across the campus, and I said, is anything I'm eating or drinking the cause of these headaches? He said that would be very rare for my type of headache. I later learned he didn't know what he was talking about. When I left the university and went into practice with 5 other doctors, one was an allergist, and people drove hundreds of miles to see him. So one day I said, how many people with headaches can you help? Oh, he said about 9 out of 10. I said, test me. And he drew some blood from my arm and told me that I was allergic to gluten and wheat and pasta, pastry. I loved it. I was overdoing it. Actually, I guess I'd become toxic to it. I didn't think I was allergic because when I ate the cupcake, I didn't get a headache. But when I left it all out, no more headaches. And the way it works is that if you become allergic to something and you don't understand the cause, when you go in and out because of exercise is good, sleep is good, sometimes you don't get as much sleep, sometimes you eat more wheat, it affects you go in and out of tolerance and you get headaches at different times. But the most likely time I got it was Monday morning because I took sandwiches Monday through Friday to work, but on the weekend my wife would give me other things, and I was going through withdrawal just like a smoker goes through withdrawal. They don't get sick when they smoke, they get sick when they don't smoke. And by the way, in this program we're going to be talking about, and a little later, tips on quitting smoking. When I was at the University of Arizona, we had 150 people taking this Stop Smoking program. And over 100 on the 5th night, it's a 5-day plan, 5th night they had not smoked, 100 of them had not smoked in the previous 24 hours. Most people can quit if they do this. I had a mayor in a little town of Missouri say, Doc, I've tried many times, this is the easiest I found it. So we have tips to help you stop smoking. Think how much money that will save your company. If your company is paying the health care, actually most companies pay about 80-some% of their employees' health care. The employees asked to pay a small part of it. And this is big bucks for bypass surgery, care of diabetes. And by the way, when I'm speaking of diabetes, I got to mention here Miriam Iwawaki, a friend of my wife's who had a stroke, did have diabetes, went into a nursing home and called begging us to get her out of the nursing home. They're killing me, she said. She was on a dozen pills a day again and doing poorly. When we rolled her into our home in a wheelchair, couldn't walk and poorly responsive, but stopped the medicines. Her blood sugar in the nursing home had been upper 200s, lower 300s, but in our change of diet and what we did is this morning, by the way, it was in the lower 100, below, yes, 150 and below is what we like. Good stuff, basically. So that's not as perfect. It's still diabetic, but on no medicine when she was on a bunch of pills in the nursing home doing worse. So yes, we can do that, and why not? end-time care is really the place to look because, sometimes in midlife, people taking medical care look about as well off as the people that are taking their own health care and being captain of their own ship, as Dr. Esselstyn says. We can do that. But if you take a bunch of pills and you get closer to the end of life, things look differently. If you have a bag of pills, the luster of life is gone. It's just grim stuff. And my worst nightmare in an emergency room was with a little lady with a bag of pills, because I had no clue as to what her problem was. I would just treat her symptom and say, see your doctor. And that's the game everybody's playing, really, because you don't know what's going to happen when with all these drugs. And so I would like to suggest medical care has a high cost in terms of the end time game. Games are sometimes won and lost in the last couple plays. And people go into a nursing home, can stand in a hallway and fill their diaper staring into space and say everything is okay. And that's not the way I want to go. I believe that we can know what's happening and be alive and well. He's the Dr. Ken Cooper, who wrote the book Aerobics. His mother, he says, was in her 90s when she went out for her exercise on a Friday, didn't feel well over the weekend, and died on Monday. No nursing home, no drugs, no nothing, just great testimony of how to go. And we can do that. We can be in charge of our own system. It deals with quitting smoking, drinking. There's another habit that many millions of Americans have, and if you have headaches, if you have trouble sleeping, if you have indigestion, if you have fatigue or trouble with your nerves, there is something that I've got to help you with in a few minutes in this talk. But we'll take a break for right now. Thank you for considering these things of how we can live well and be on a better health destiny without the medical care which can kill you.